Okay, Suzanne in therapy with Suzanne. I noticed yesterday that when I looked at my therapy session from yesterday, that I am still very scared of changes in myself. That when I notice changes, voice changes, facial expression changes, emotional changes, when I notice changes in myself, I'm still very, very scared of these changes. And I've been that on and off since childhood. I remember it from very, very, very early childhood. And I have also had a lot of problems in my life with not being able to recognize my own face and to recognize my own reflection in the mirror and so on. And this comes and goes. It's worse, then it's better, then it's worse, but it has been there for very, very many years. And it also started long before I got a dissociative disorder diagnosis. And for the viewers of this video, I just want to say that I was diagnosed in the old-fashioned way. I was not diagnosed in the way where I first found a community online and then I went to the psychiatry and asked for an assessment and so on. No, I was diagnosed the old-fashioned way. I'm so old that even though I am chronically online, I'm still from the generation that do not view the internet as some kind of starting point for anything. So I went to the healthcare system and asked for them to diagnose me. And so I was diagnosed with a dissociative disorder. I used to have just a general anxiety diagnosis many years back, and it's the general anxiety craze. There I'm off again. Now I'm stressed again. Oh, the anger. Oh, it's difficult to scale it back here. So I was 37 when I was diagnosed with a dissociative disorder for the first time. And there had been hints to that before, like, I feel I'm derailing a bit now, but just want to mention that there was a therapist, a private therapist I saw when I was 25, about around there, who did a personality assessment of me, or started with a personality assessment of me, and who noticed, he said it to me, that he asked me, because I was filling out this questionnaire at home, and he asked me if anything had happened during me filling out this questionnaire. And because he noticed that I, in the middle of answering this questionnaire, suddenly changed answers to the opposite pattern. And what had happened then was just that my ex-husband came home from work and or from studies, I don't know where he was. but that was what happened. He came home, he came in the door, And I remember this, I continued filling out this questionnaire, and I did not notice any kind of change in myself. I was just sitting there with that questionnaire, and he came home, and I continued filling out that questionnaire. He was not in the room, he was just home. He was not sitting there with me or anything, so I was still free to answer the questionnaire as I wanted. And that was kind of like an early hint to that something was a bit off with me. But I was 37 when I was diagnosed with a dissociative disorder for the first time, and it took a very, very long time. And I think this is important context, because it was not a psychiatry that gave this diagnosis to me first. It was the neurology department. They suggested it, and then I had to go to the psychiatry and they had to confirm it. So I am diagnosed the old-fashioned way. And reason why I'm saying this again is that because it's this, both in the psychiatry and in private individuals in my life, and in also online. I see it a lot online. There are a bunch of people in this world who do not believe in the dissociative disorders, who do not believe in the multiple personalities, and that say that the patients who claim to have that, they are all a scam, and so on. So I just say this again, that I was not diagnosed by first finding the diagnosis and then suggesting it myself to the psychiatry. No, I was diagnosed with it because I had so much physical problems. I had so much physical illnesses, infections, different kind of weird symptoms from parts of my body where they couldn't find anything, and then suddenly, the symptoms occurred in a completely different part of my body, and then they found injuries and infections in other parts of my body. And so it was very clear that I was in very bad contact with my own body. And so I was diagnosed because I was physically breaking more and more and more down, and it was so difficult to understand what was actually going on with me. So I got my dissociative disorder diagnosis that way. So, and I am not in any kind of community or I have, and this is because I am constantly distrusting this diagnosis myself, constantly, like every day. And that makes it a bit, because when I also then see that other people are distrusting this diagnosis, and that other people are kind of hinting to that I am just making this up, something I have been told my whole life, that I am just making my symptoms up. And that's very distressing to me. And it's because I was not diagnosed in a way that can make me into a scam, because I was fully giving that task to the healthcare system. So I am I have been through all the testing in the neurology departments. I have been in many departments in the general hospitals. There has been a lot of different experts talking to me, and that in the end resulted in the diagnosis. So yeah, it makes me so angry. It makes me so fucking angry that even healthcare personnel can come to me and say that, oh no, you are making this up. And it's like, that's so scary, because I was not the one suggesting this. This was suggested to me from the healthcare system. And then I had to look at it and say, oh, yeah, this is actually what I'm struggling with. So it's just plain, oh no, I have to scale it back here. This is a hard session for me because I'm so triggered. But what I'm trying to address in this session is that when I looked at yesterday's session, the video from yesterday's session, I noticed that I became so scared every time I noticed a change in myself, the tiniest little change. And this is a fear. I also notice changes in other people, and it's also kind of obvious because I'm now an expert in these things, so it's very logical that I will notice things in other people. And that does not scare me in any kind of the same way. It is when I notice these changes in me that I'm scared. And the thing is that I don't quite want to believe in the diagnosis. I don't really. But at the same time, I know that there are these other states of me inside me. And I think what's happening to me is that when I notice these changes in me, I also notice that these changes can trigger, and maybe that's maybe that's the actual explanation for this, that me doing different changes with my expression, with my body, with what I'm doing just in a day, that can trigger the personality changes in me. That can trigger me into forgetting some things and remembering other things, and then suddenly the world changes. Because these changes, when I change personalities, it's severe. It's like I really do not remember what I was, and it can cause me these horrible panic attacks, really horrible panic attacks, that I watch. For example, I walk into a room and it's somebody has cleaned up my room, and I don't know when or how I did it, and it's just forgotten, it's just gone. And then I realized that I have dissociated. I have gone through a personality change here, and so suddenly then there is this extreme panic attack where I am, before I knew about the diagnosis, I just got these panic attacks and had no idea what was happening. But now the panic attacks are more like, what might I have done in another personality? Because I never know. But at the same time, I do know if I just let the minutes and hours pass, I know that I will remember it again. But it can be so scary that suddenly because in every personality state, when some things are forgotten and other things are remembered, and I suddenly see the world in a different way, I know that this is important to me. This is also how I work. This is how I analyze things, by remembering something and forgetting something else, so that I can and it probably has, my to work as a researcher has probably made this worse in some way. I think I have to come back to that. That's a very interesting aspect of it. So it is important for me. It's not something that is inherently problematic. It's a very important. I do use it for good. I do use it to analyze the world from different perspectives and from different angles. But I'm forgetting what I was supposed to say. Yeah, I can just go back to the thing that when I see these, just to repeat, it can cause me a lot of panic. To switch a personality can cause me a lot of panic, because I don't understand. It looks a bit weird when I go online and say that I'm the world president, and suddenly I log on to my Twitter account and see that I have been tweeting about being a world president, and then I can't remember the thinking I had behind writing that. And I go in there and I think, was I in a full psychosis? And then after a while it comes back to me that, oh no, yeah, I'm actually having this plan behind, this is a meme and this is blah blah, it's right here and now I just can't remember it. So I'm kind of starting to panic here too. And I also know that I have this grandiose part of myself where I go fully into this. Yeah, you can call it a psychotic state, but it lasts for 2 minutes at a time or something. So it's not I wouldn't call it a formal psychosis, but that is very scary. So, that is very, very scary to have this constant amnesia, and having to kind of just sit back and trust that it will come back to me. What I was thinking will come back to me if I just relax and let time pass. And maybe it can go so much as a week or 2 weeks or 2 months or even years sometimes, but it will come back to me. So I will kind of remember. I will remember it in the end. But so what I'm trying to aim at here is that I think me becoming very scared when I notice changes in myself is that I'm scared that, for example, a voice drop. If I drop my voice, that will trigger memories and making me forget other things, and suddenly I'm in another personality. Or if I do changes with my face and stuff, it would also trigger changes, and if I do changes in my environment, it would trigger changes inside of me. So I think that's the explanation. I think that is the explanation. And of course, to go back to my childhood, these changes in especially my mother, also my father and other family members, but especially my mother, small changes in my mother also indicated that she was changing personality, and or at least that she was triggered, that she was on her way into this extreme anger or extreme crying, or I'm still a bit unsure if I should call Mama a person with multiple personalities or if she is just personality disorder. I assume that she has multiple personalities. I assume that my grandmother has multiple personalities. I assume, yeah, that's for another video. But it's not, I think it's wrong to say that this is caused by my childhood trauma. Again, I don't think that's true. I think it's very self-explanatory in the dissociative disorder that watching changes in myself, discovering changes in myself is scaring me, because I know that might trigger me to go into a completely different mindset, completely different thinking pattern, and that to change personality like that will cause me huge panic attacks, will cause me every personality change. It's important for me to change personalities to get access to the whole of me, so it's not like I'm trying to just sit in one personality all the time, because that is just a very narrow worldview, and I need to remember my memories, so I need to kind of switch through the program. So it's not that I don't want the switches, because I need the switches to be able to function, but it's scary to switch, it's stressful to switch. It is because it will cause me temporary panic. It will cause me temporary to have to sit and manage. For example, yesterday I had this very, very weird thinking yesterday. And I'm not going to go into it in this video because I think I'm going to panic if I do. But suddenly I had this very weird thinking. And I used 30 minutes or something on talking to myself about that. No, you have a dissociative disorder. Remember that this is scary thinking, but it's very unlikely that what you're thinking now is true. Just let time pass and you will start to slowly realize, oh, okay, no, I'm remembering. Yeah, okay, yeah, this did not make sense. So it's just hard to switch. It entails a lot of work for me. It entails that I have to kind of stop with what I'm doing and sit for 30 minutes, an hour with kind of active. I kind of always have to very actively, because some people might think that it's just a panic attack, so I can just sit still for 20 minutes and it will pass. No, I can't just meditate my way out of it. I can't just sit still. I can't just... It entails a lot of work, active memory work. I have to actively seek into my own brain and seek into the environment and look at stuff I have been writing and stuff to kind of trigger the memories. So it's very active work and to get out of this these panic attacks. It's not just sitting still for 20 minutes. Sometimes it is, but most often not. Okay, I think I found it. It's to view changes in myself, to spot changes in myself and in the environment, makes me scared, because I know it can trigger personality changes. And when it triggers personality changes, I have to do so much to not develop full-fledged panic attacks, and to kind of get back on track. It's hard work. It's just hard work, and it's scary. So yeah, small changes in myself. It's not caused by my mother scaring me. That too, but that's just a little part of it. I'm okay, I'm starting to get angry again, but can't I just say this one more time before I end this video, that this childhood trauma discourse, it's just ruining so much. And to always be asked about, did your parents do this? Did your parents do that? And I'm 45. I'm turning 46 this year, and I don't even have contact with my parents anymore. So it's so irrelevant. It's so, and it's something that it takes away my concentration on myself. It's to always have, suddenly I see something here. The childhood trauma discourse, the childhood trauma attitude, that when everything is about childhood, and we are to talk about our childhood, and we are to talk about our parents, and everything is caused by our parents. It's just the same as when I was a child, where my parents wanted me to focus on my parents all the time. It was that generation who kind of, we were just slaves, and I'm going to go into that in another video. I have written a lot about that on Twitter. So for people who are interested, go to my Twitter account and search slave brain, slavehjerne in Norwegian. So if you are interested, you can go to my Twitter account and search for that there. So this constant focus in therapy on childhood, it's just the same as when I was a child. Concentrate on mama and papa, don't concentrate on yourself. But I want to concentrate on myself, because a lot of my struggles today as a 45-year-old is caused by having the disorder in itself. And I have to have that disorder. So I have to be allowed to focus on myself for once. I'm starting to be angry again. Okay. Good therapy session. I found something that is important, and that is that it's just, I feel this fear of changes in myself, because changes in myself indicates bigger changes in myself, and the bigger changes in myself causes me panic attacks. So I become scared of the changes, so that I can kind of stop the changes from happening, so that I don't have to go into this full panic attack. Yeah. Fear to battle fear. I'm having fear to battle fear. Yeah, okay. Goodbye.